Good afternoon, Wolverines, and thank you for joining us in today's Town Hall Talk with Tuminez, focused on COVID-19 and all of the implications of this pandemic for the university and what we are doing. Thank you especially to you students for engaging. We have received over 200 questions from you, and we've read all these questions, and we will do our best today to answer them. If you have seen the video last week, some of our faculty members recorded a video to encourage you and express their care for you. And so I hope that you've taken time to see that video. Several of our faculty members really came across as the very caring, kind, competent faculty members that they are, how much they care about you and how much they want you to succeed. So I want to thank them. I want to thank you for engaging with them as we've moved many of our courses online. I want to thank the staff who have supported you and supported me and supported our faculty. Even today, being able to do this talk with Tuminez, I am very grateful for our communications team, our camera people who are here in the studio with me, my own staff, my cabinet, because we couldn't do this without a group effort. So thank you all very much. We have read your questions, we hear you, and many of the questions that we got from you students were about commencement, about graduation. So if we could put up the slide here, we have a new date, and unfortunately, because of the situation we're in with COVID-19, things can change very quickly, and they do. So as of the close of business yesterday, we had a definite date. As of this morning, because of the many moving parts and the people involved and their obligations and responsibilities, what we could announce today is that commencement will either be on August 19 or 20. And we hope in the next few days to be able to really pin down the details and be able to announce that to you. So please continue to be patient with us. As of the moment, we still have Gail Miller, prominent philanthropist and businesswoman, as our commencement speaker, and Professor Dave Ulrich and Mr. Dan Campbell as recipients of honorary degrees. So I hope this gives you some guidance where you could do a little bit of planning now for August 19 or 20. Thank you again for your patience. I also want to talk a little bit about some of the steps that we have taken as a university to respond to the COVID-19 pandemic. Many of the steps listed on the slide that you're seeing now is something that you've lived through as well. These are not just words on a slide. So if you look at this, we have had to pivot very, very quickly right after spring break. In fact, during spring break, many of these things had to be put in place. Thank you for pivoting to remote or online delivery of many of your courses. We have had to cancel events and travel, and these things are not under our control. We are following the guidelines that have been given and then marrying our own policies and measures so that we could do the maximum to protect our faculty, you, our students, and our staff and our community. One of the things that would be of particular interest to you among the steps that we are taking with the COVID-19 is the CARE fundraising. CARE stands for Coordinated Access to Resources and Education. And we have, in the past few weeks, enhanced our fundraising for this initiative. The reason for that is we are very cognizant that some of you, because of COVID-19, have faced new needs that are urgent, that are truly necessary, like housing or food. And I'm very proud that in the space of just 3 or 4 weeks, we've been able to raise about $16,000. And I'm grateful that some of you have been able to get what you needed from our food pantry or ask for temporary financial assistance for the things that you need very urgently so that you can stay in school and stay engaged with your studies. What I would like to do next is introduce you to Professor Sue Jackson, who is our associate professor of public and community health. Professor Jackson is an epidemiologist, and we asked her to record just a brief video explaining the context of COVID-19, because I think this context is really important for us to understand as well as possible what we are dealing with.
Thank you, President Tuminez. I'm happy to be here with you today and with the UVU community to tell you a little bit about epidemiology. I teach the epidemiology course in the Department of Public and Community Health. Epidemiology is all about disease, where it comes from, the risk factors, tracking disease cases, and looking at rates over time. I want to share some of the data that I'm looking at with all of you. This first chart is an Excel file where I've tracked the number of cases per day for both Utah and Utah County. This is just the last couple of weeks that we're looking at here. The first column is the number of total cases. So that includes recovered cases. It's everybody who's been diagnosed with COVID in Utah. Utah's in green, Utah County is in peach. So that first column is total number of cases. That second column is the number of new cases each day. So cases that were diagnosed from the day before. The last column is the rate of change. So when we look at rate of change, we're looking at today's number divided by yesterday's number to see how fast it's growing. Now, as that rate of change gets closer to 1, that means that the disease isn't growing at all and we've stopped the epidemic. But if the rate is much higher, so for instance, if we look at Utah on March 28th and we see a rate of 1.25, that means we had 25% more cases than the previous day. Now, we've been as high as the 1.3s and 1.4s, and we're starting to come down. So as you start to see those rates decrease, that's a reflection of our social distancing that's working. Now, as we look at the rates for Utah, this line chart is showing that rate of change over the last week or so. And so you can see that we've started to come down. It's a little bit rough because our testing data isn't great. So the bar chart's going, or the line graph is going up and down a little bit, but we can overall see a general curve downward in that rate of change. If we compare Utah to the US and Utah County, though, it looks a little bit less favorable for Utah County. We're seeing the US at the rate of growth of 1.13, Utah of 1.11, and Utah County of 1.20. That means we're actually growing faster than the US is and Utah is. We have 20% more cases than the day before is what we're averaging for the last 7 days. Now, the encouraging part is the last 2 days have been pretty good, and I'm hopeful that that's a trend in the right direction for Utah. This next chart looks at the number of new cases. Now, what we're looking at here is we're hoping to peak out in the number of new cases and then start to come back down. It looks like we have a little peak there, but we've got to watch the data longer to see if that's actually the peak for Utah or if we're still going to have more new cases in the coming days. This next chart breaks down Utah by the health district. So we have health districts in Utah that then report to the state health department. In Utah County, it's easy because our county and our health department are the same geographical area. And so when we look at Utah County here, we are number 5 in terms of the health districts in our incidence rate. Now, an incidence rate is the number of cases per 100,000 in the population. This is where the news media has gotten it wrong because they keep talking about the number of cases without talking about populations. You can't measure the extent of an epidemic without looking at the population size. And so as we're looking at this, Utah County is sitting at 37.9 cases of COVID for every 100,000 people in Utah County. So you can see those incidence rates in that very last column there. This next chart breaks it down by age. We've often heard that this is an older person disease, but that's not really what we're seeing. We're seeing that the highest incidence rate is between those 45 to 64, and that the highest percentage of number of cases actually comes from 25 to 44-year-olds, with 40% of our cases in that population. This next chart is going to show a similar idea, that we actually have a lot of cases in that 25 to 44-year-old category. In fact, if we take the 15 to 24 and the 25 to 44 categories combined, that's 55% of all of our cases. So even though we might say this is affecting older people more seriously, we actually have more cases in that younger population. A couple of things that I want you to keep in mind. Number one is that we need to watch that rate of growth. We need to stop the growth from being so exponentially high. Number two, is that we need to look at our numbers per 100,000. We can't just look at raw data and look at how many cases we have, but we have to look at it on a population level. And then 3, the evidence that our social distancing is actually making a difference. You can see that in the numbers. We need to stick with it, especially in Utah County, and make sure that we limit our contact as much as possible and only have essential services so that we can bring this pandemic down.
Thank you, Professor Jackson. And students, I hope that you found Professor Jackson's overview helpful. Please remember what she said. Most of you are young, but you are strong, but you're not invincible. So keep social distancing. I hear reports of students in the library who are not properly social distancing. So please listen to this carefully and follow the advice. So again, my thanks to Professor Jackson. I now have here in the studio Robin Ebmeyer, our Director for Emergency and Safety on Campus. Robin will spend a few minutes talking to us about steps that the university has taken to date, and she will also answer several questions that came from you about campus environment and safety. We are very grateful to Robin, and I want you to know that every day my cabinet and I meet with Robin to get the latest expert update and the data to inform the decisions that we are making at the university. So over to you, Robin.
Thank you, President Tuminez. I'm grateful to be here, and hopefully the next few minutes we can answer some questions that have come our way. In about mid-January, I became aware of this potential virus that popped up in China, and I started monitoring it right away just to see where it was going to go, and started immediately to update the president and the cabinet about the progression of this virus. As you know, this virus has made it all the way to our state, to our county, and even to our campus. It has impacted us, every single one of us, in emotional ways, in physical ways, in mental ways, and even economic ways. There isn't anyone that's going to escape the effects of this virus. So one of the big questions I get is, why have we not gone to the orange level? Why do we seem to be stuck in the yellow level? And I want to answer that question by directing and talking to you for a minute about Governor Herbert made a state directive entitled, "Stay home, stay safe." This is not a shelter-in-place order, but it is a directive that helps us to plan and to look at our own plans and go from there. Within days of that directive coming out, we looked at our own plans, we compared and contrasted and made some changes to our own plans to better match what the governor had said. I want to read a couple of things that are actually in the directive, so I'm going to be quoting a couple of things. Under the travel section, the governor's directive says, quote, "Essential travel means travel to perform work if you cannot telework," unquote. The directive also states we should, quote, "refine business response plans as needed," unquote. As I mentioned, we've completed a review and updated our own plan to better reflect the governor's directive. The directive also states, quote, "Only employees or volunteers who perform work that cannot be done from their homes should be exempted from telework," unquote. The directive also states that we should implement flexible hours and scheduling, which we have been doing and will continue to do across campus. I would add that our main purpose for staying open on campus is for student success this semester by completing their coursework. We have shut down several buildings and have a few that are left open that we consider to be those buildings that will help with the student success this semester. Those basic essential services are needed in order for them to be successful. There have been some questions about this week. In fact, the CDC came out with a recommendation that we wear masks when we're out in public. There have been many requests across campus, and we've been able to distribute masks to people so that they feel that extra layer of protection. There are many superstars in all of this response that should be acknowledged. those that continue to make campus safe, secure, comfortable, and clean deserve our thanks and gratitude. Some have wondered about our cleaning processes on campus, and I would like to let you know that early on, we looked at the CDC guidelines and looked at how we were cleaning to match those up to ensure that we're using solutions, chemicals, disinfectants that the CDC recommends. And we have been doing that. We have always been doing that, I would add. Another question that comes up is what happens if someone on campus gets this virus and tests positive? So the process is if someone, a student, faculty, staff, were to test positive for the COVID virus, the local health department is notified. It is their responsibility to trace, track, and do surveillance, which means that they would notify anyone who had been in close contact or had some significant exposure. And then there would be guidelines as to what to do. One thing we have been able to do this week is to put up a self-reporting form. This is voluntary. It isn't mandated, but you could go in and fill out some information stating that you had tested positive for the virus. Now, what are we going to do with that information? That information would help us to assist the local health department, but it also helps us to know where on campus those people may have been, so we can do extra cleaning if we need to make that environment safe again. Lastly, I would say to you things you have already heard. My number one right now is to stay at home if you're sick. Take care of yourself. Please stay home if you're sick. Also, wash your hands, don't touch your face, and exercise social distancing.
Thank you, Robin. Very quickly, there was a direct question about how many cases of COVID-19 have been diagnosed for UVU students and employees.
That's a good question. Because we have not been contacted by the health department, I don't have a clear answer on that. So I don't know the answer. I know that there have been some that have been brought to my attention. We're pretty careful about the privacy of the students, so we certainly have not and would not release names. Have chosen to be private and allow these students, if they wish to tell us. And our concern is, where have you been? Were you here in the last 2 weeks? For the students, a lot of them haven't been here for the last 2 weeks, so that's been helpful. So we use that information very carefully to protect the privacy, but we also use that information to make sure the areas have been cleaned and that we're safe again.
Okay, one final question to Robin, and I will read the question directly. Why are you putting everyone at risk of exposure with staying open? I have family that work there, meaning at UVU, and they feel trapped. If you were really concerned about the safety and continuation of education, you would be offering solutions. Why are we not putting Wi-Fi hotspots in the parking lots instead of letting students and the general public roam around the halls, potentially infecting everything? Seal the school, offer better alternatives.
That's a big statement. There's a lot going on in there. I think what I would say is that it is our concern to keep our students and our staff and faculty safe. We talk every day about how we can do better. We have instituted many plans to keep them safe, and some I've just mentioned about limiting access to buildings, sending people home that are high risk. We've done many things, and to include, this directive of the CDC, their recommendation to wear masks. We have some masks that we've been able to pass out. I think
sorry to interrupt.
No, it's okay.
I think we are not letting students and the general public roam around the halls. Let's just underline that we are not letting students and general public roam around the halls.
We are not doing that. And in fact, we have even asked that, every once in a while you'll see a spouse or a family member come visit an employee or someone here at work. We've asked them not to do that. Just don't come here. We don't want any more exposure. I honestly feel that this is a pretty safe place to be. Like, I'd rather be here every day than to brave the lines at Costco or a grocery store, because I feel like there's greater exposure there. Because of our custodial staff, making sure everything's clean, I really do feel like our exposure is much less here because of cleanness. Our social distancing has been good. And so I really feel like we are doing, but I will say this, we are always looking at what can we do more? Have we done enough? Is this good enough? We are I am very critical of myself about this because I want to make sure that we're doing the right thing for the students.
Thank you very much, Robin. Let me now bring to the studio Provost Wayne Vaught to discuss some of your questions with regards to academic affairs. Welcome, Wayne, and you'll all notice that Wayne is sartorially correct with his green tie, so we applaud him for that. Wayne, there are quite a few questions for you. Let me begin. How does offering students the credit, no credit option provide any sort of benefit? In what case would you suggest that opting for credit is better than a letter grade?
Yes, we've been working with students, and students across the country have been asking about this issue because the transition that so many of us have had to make from a face-to-face environment to an online environment has been disruptive, and in some cases students are very uncomfortable with that. We're not actually making any recommendation as to whether a student should opt for a letter grade or credit, no credit. What we've been trying to do is to provide students with all the information that we can so that they can make an informed decision as to what would be the best case for them. A situation where a student might consider opting for a credit, no credit versus a letter grade would be if they have an elective course. The circumstances, the transitions, the life experiences, all of the things where COVID-19 has caused disruption this semester might have caused you not to perform as well as you might otherwise have done. You could opt for a credit grade, and this wouldn't matter whether it's an A, B, C, D. If you opt for the option, it won't impact your GPA. So that would be a situation. Now, there are a lot of circumstances, however, where receiving a credit, no credit might impact you in ways other than just receiving credit for the course. If it's a course that's required for another course, if you're applying for graduate school or a professional school, if it's your organic chemistry class and you need a letter grade to get into medical school, these are some things that you might want to take into consideration. Furthermore, if you get a no credit or fail, this could actually impact your financial aid for this semester and even future semesters. So what we are strongly advising any student who might consider, I would really rather get a credit, no credit than a letter grade this semester, is to go to the website, which you can go to UVU Records office. There is a link on there. You can also find it at UVU Info. And if you go in the student FAQs, you can find a link there. So we've tried to make this readily accessible to you, but ultimately talk to your instructor, talk to your advisor, and figure out which option would really be in your best interest.
Will classes continue to be credit, no credit through the summer if classes remain online?
No, they will not. This was just a one-time semester, and it wasn't because they are online courses. It was because of the disruption. So courses that had to transition from face-to-face to online, we wanted to give this one-time option to students.
So in the summer, since most people know already that their courses will be online, it will be back to regular letter grades.
It will be back to the regular letter grades for the courses, which will either be all online or face-to-face. If there were another disruption that we can't anticipate, that would be considered, but this is just a one-semester option for students at this time.
Okay, let me now go to a few questions with regards to academic instruction. Due to not being able to meet in person, it is becoming increasingly difficult to get in touch with faculty. How are members of faculty being held responsible during this time?
I think we've had really good and very positive responses from students regarding faculty reaching out, and all faculty are encouraged to respond in a timely manner to students. If you're not having your instructor respond to you in a timely manner, please reach out to the department chair where that course resides, or even the dean's office if necessary, where that course is held. And again, I will refer to the academic continuity site, or it's an email address. You can contact us in the provost office at academiccontinuity at uvu.edu, and we will happily look into that situation for you. But all of our faculty most of our faculty, I would say, have been very responsive, and we've gotten very good feedback from students.
So remember that email address. When in doubt, if you're not able to reach faculty, as Professor Vaught said, contact the department first or the dean. But this email is constantly monitored. academiccontinuity@uvu.edu. Someone will always read that email and respond. What will happen to the classes that require labs like anatomy and physiology? Will we be able to take them online?
Our faculty have done everything they can to identify alternative course work and requirements to allow those lab sections to go. There have been some cases where we have had to disrupt the course entirely, but I think even in those situations, we're working really hard to be sure that students can complete the coursework. Again, if you have any questions, contact the instructor specifically and find out what's being done to allow you to receive credit for that course.
The next two questions are a little bit along the same lines. As a student whose major is a very heavily hands-on type learning, I was displeased to learn that the classes for my major this summer have gone online and thus caused my department to cancel the summer classes. How are you preparing to handle those majors that require more hands-on lab-based learning rather than in-class lecture-based learning? And the next question has to do with internships. I need to do an internship for my degree, but now that's going to be impossible. What can I do so that I can graduate as soon as possible?
In terms of the courses and the labs, we did have to, because we anticipate we're going to be peaking here in the next week or so with COVID, and the anticipation is that will carry through until June. So our June courses are all going online, and our full summer courses will be online. We are holding open the possibility that some courses in that second session of the summer school, depending again on the health conditions in Utah County at the time, will allow us to offer some of these hands-on type of courses at that time. Stay tuned. We hope to be able to make an announcement around May 1st as to what we will be doing with those late summer courses. But I hope we'll be able to meet student needs then. Internships are begun also a challenge. Many of our students do have required internships as part of their degree programs, and some of these are things that are completely out of the university's control. I know that there are students who have internships in San Francisco, for example, to meet some, had those set up to meet their requirements here. And so travel restrictions and even closures of employment opportunities are creating challenges for our students. I would again advise you to talk to your academic advisor, talk to the faculty within your degree program. Again, the university is just doing everything we can to try to find alternative resources and options for our students so that they can continue on their degree paths.
There's one more question here about summer semester, but I think you've pretty much answered this, but do you want to just repeat? Are we going to be attending classes on campus? just repeat the answer to that.
At this time, all of our courses for summer are scheduled online. We are holding open the possibility for the second summer block we may be able to revert back and offer some very limited number of face-to-face courses. But we can't make that decision just now because we don't have the health information to really, again, protect our students and protect our faculty and protect the staff who allow us to provide you with the educational experience that you expect from UVU.
Thank you, Wayne. Please join me in thanking our provost. There is now a question on tuition that I'm going to answer. The question is, why did UVU increase tuition at this time? Many students have lost their jobs due to COVID-19 and may not be able to come back next year. Tuition is always increasing, and the students of UVU, myself included, are sick of seeing it spent on frivolous things. UVU has long prided itself on being affordable. That does not seem to be the case now. So let me answer this question about tuition. I'm going to show a slide here, if you could look at this. This is a chart that shows UVU's tuition in the last 5 years and going into the academic year 2021. If you look at these data, you will see that the highest tuition increase, tuition and fees together that we've had is about 2.67%. That is lower than the Utah system of higher education average, which is 4%. So the takeaway from this slide is that in the last 5 years and going into academic year 2020 to 2021, we have been quite good at keeping the increase in tuition and fees manageable. On the next slide, you will see the response to the question, where does this money go? Does it get spent on frivolous things? The most important thing to remember about tuition is that it funds the most essential things, which is primarily compensation, medical benefits, risk management, and also faculty merit, rank, and tenure promotion. The state of Utah only gives us 75% of the funding we need for compensation. The university must come up with the other 25%, and that's what we use tuition increases for. On the next slide, you will see that within the Utah system of higher education, USHE, where do we stand? We are right in the middle. We are not the most expensive, and we are not the cheapest. We believe that the tuition and fees we charge are aligned with the value that we offer here as an educational institution. And on this next slide, when we compare ourselves to our peer institutions, let me try this again. If somebody could advance that next slide. When we compare ourselves to our peer institutions, these are other universities similar to us. We are the cheapest. That smallest bar is Utah Valley University. And then finally, in the United States, when we compare ourselves to other public four-year institutions, not just UVU, but Utah as a state, we have the third lowest tuition and fees in the country. So we understand that it's still a burden for you, and our commitment is to help as many of you as possible to be able to meet and bear this burden. But please know that the facts and the data that I have just presented shows that we have been quite good at keeping the increases in tuition and fees under control. I will now invite Vice President Kyle Reyes of our Office of Student Affairs to come and answer a few questions. Welcome, Kyle.
Thank you, President.
And Student Affairs, there are many, many questions directed to you because you take care of our students. Anything that is not academic falls under you. So the first set of questions is about financing and student resources. Let me just read the first question. As a student, the financial costs of not being able to work during social distancing will directly impact my ability to continue attending future semesters. Are there any resources available to help students like me? I have previously applied for financial aid and scholarships, but still struggle with insufficient funds. What advice would you give me?
Thank you, President. And to the student that wrote that question or any questions similar to that, first let me just say, we hear you and we see you, and we have received similar questions like that. Two things that I would point you to first to start out with. One is, as it relates to federal financial aid, the FAFSA, or what many know to be Pell Grant, some students in the past who've applied that didn't qualify may be eligible now for FAFSA support. And so we always invite students to reconsider and reapply for federal financial aid. The second thing to note is that we are not the only higher education institution in the United States dealing with these issues right now. And so the U.S. and the federal government has allocated, or will be allocating shortly, some resources to higher ed institutions, to universities and colleges all throughout the U.S., and definitely UVU, to support students in this very situation. And so we have assembled a team of folks to address what's called the Federal CARES Act, that will be enacted soon, and where finances will come to the institutions. And that group of individuals will look at various ways that we can get those resources directly to students for scholarships and other financial needs, starting with a summer semester and into the fall semester. So again, I point you to as well the financial aid office, uvu.edu/financial aid for updates. And please note, anytime we send out university updates, we just invite you to read that thoroughly. We are trying to keep you up to date with what's happening both locally, nationally, and then with the institution.
The next question, will we be able to get a refund and drop classes? Does the school or the financial office have any plans to defer tuition payments?
Thank you for those questions, and we've received that a number of times. At this time, no, we will not provide refunds. we are encouraging students to recognize that we've pushed the withdrawal deadline to April 24th, and students have until that day to withdraw, but they will not receive a refund. And as far as tuition deferment goes, while we will not do that this semester, we invite students to take advantage of the short-term tuition payment plans for future semesters coming.
I think if I might comment on that as well, so because classes are continuing, but the modality obviously has changed, it's online and remote, we do want you to complete and finish, and your fees are continuing to pay for the offering of education that is still very much alive and offered at the university. The third question here is, COVID-19 caused my loss of employment. Bills and other necessary expenses piled up, so I had to place getting money for my family first. Grades are now terrible. I realize the lack of work is on me, but how can the university help me get back on track with my educational goals? And I sense the pain in this question. What would we answer?
Definitely, President. And again, whoever the student that wrote that in and any other students that express similar sentiments, we feel that with you in terms of hearing from you. And so let me offer a couple of perhaps avenues to consider. One is as it relates to finishing out this semester in the best way possible so that you don't jeopardize future academic success and long-term goals for your degrees. We invite you to reach out to your professors. Reach out directly and see what you can do, what they can do, and working together to absolutely get the best possible grade you can for this semester. We recognize that this whole experience has not been ideal, and we are trying our very best at every turn. And I have to just commend my faculty colleagues across the whole university. We've had faculty in various disciplines, in all of our disciplines, who have really reached out to their students, who have tried to make this as painless as possible, but also who are wanting your success, not just for the short term, but for the long term. So please reach out to your faculty. Secondly, if there are any other requests for resources, needs, services that you might have, I invite you as students to email deanofstudents@uvu.edu. This email is directed by our Dean of Students, Alexis Palmer, and she has an entire team of folks ready to make sure that you get connected to the right services. This is anything from requests for emergency funding and just explaining your situation. This is also getting connected to perhaps folks within the academic affairs arena. And then also just perhaps student health services and other services that we're currently offering remotely. So please reach out, please email deanofstudents@uvu.edu.
Thank you, Kyle, and thank you to everybody who monitors that email, deanofstudents@uvu.edu. Other schools are giving $800 grants for computers. Are we going to receive something?
We do not offer computer vouchers. We have been checking laptops out from our library and some of our other programs. Again, if you have need of resources, we invite you to go to a website for an application. This website is called uvu.edu/studentcare. What you'll notice at this website is an application. As soon as you come onto the website, you'll know it talks about basic needs and securities, food insecurities, housing insecurities, and other things that students might have need of. Right there on one of the first tabs is an application for emergency funding. And if for whatever reason you feel like you might need some emergency funding, you can submit an application, explain your situation, and it can go towards various things that you need at this time to finish out your semester.
Okay, a few more questions. With this pandemic going on, what is the effect that it will have on registration and classes beginning this fall?
Yes, we are encouraging students to stay with higher education and register for summer and fall, but priority registration started this last Monday. All new students will be able to start registering on April 15th, and our message is primarily this. We know that there's a hiccup in the current semester, and we know that this was a disruption to your academic pursuits, but we also are moving forward in a solid way, both in summer offerings and in our fall offerings. We invite you to register. We invite you to continue your academic pursuit and stay on track to complete a degree.
What is the effect on scholarships if the student elects to take a pass-fail grade?
Well, as Provost Vaught explained, we actually have a credit, no credit option. And if you, as a student, take a no credit option, please recognize that as it relates to scholarships, that might have the same effect as a failing grade on a scholarship. And so that is nuanced, and it depends on the scholarship or the financial aid resource. Here's what I invite you to do if you're in that situation or even have questions. Our Financial Aid and Scholarships Office stands ready to answer these questions. We invite you once again to go to uvu.edu/financial aid. The entire philosophy of that division right now is to work with you as much as possible so that you can continue to persist with your education. So please reach out to that division.
I'm sure our students are very grateful for the flexibility and the listening ear in the Financial Aid Office, so please do take advantage of our staff who are there to help you. Would the online classes affect the immigration status for international students next semester because the requirement is 9 credits face-to-face while the rest can be online?
Thank you for that question, directly affecting our international students. Because UVU made the decision to go completely online for at least the first block of the summer, the U.S. Immigration has allowed international students to take these online classes and to not have that restriction that is previously built into their contract as an international student with U.S. Immigration. So for right now, we've received word from U.S. Immigration that our international students can take online classes because we made a university decision to do so.
Yeah, I think that is a reasonable approach. We have a couple of questions on mental health. Where can students struggling with coronavirus-related anxiety or mental health struggles in general turn to get support during this time? Is there online counseling or therapy options available? What is UVU doing to ensure students' emotional well-being during this crisis?
President, I really appreciate this question. I will say that when this all started, we, as not only a student affairs division, but as an entire university and cabinet, one of our first questions was to talk about how we are going to ensure the student health, wellness, and well-being. Please know, students, that at every turn, in every meeting that we're in, we are concerned about mental health issues. We are concerned about making sure that we remove barriers and that we're getting you information that you need. Specifically, as it relates to the question of what services continue to be provided, let me just let you know that we are providing mostly, our services are being provided remotely. And we have seen not only a continuation of students taking advantage of these services, but an increase in some areas. We're providing teletherapy, telecounseling. You can schedule an appointment online. You can visit our Student Health Services website, or again, just to make it simple, simply email deanofstudents@uvu.edu, and Alexis's team can direct you to scheduling an appointment with Student Health Services. Please also know that we're offering group therapy. We're reaching out to students in various ways, and we're trying to make sure that we're partnering up with our local partners like Wasatch Mental Health and other services in the area to make sure that we're addressing not only just student needs, but student and community needs in the best way possible. Again, we have an entire task force that meets regularly just to talk about student mental health and student care issues. And so once again, we invite you to email our Dean of Students.
Thank you, Kyle. These last 2 questions, I'm going to read them together because I think this reflects some of the frustration that students are feeling and experiencing, and this links as well with the topic of mental health. Why is there little to no thought or care to student mental health with an ongoing pandemic? Because I don't feel like there was any. We were just told this is how it is, and if you fail, it's your fault for not being gritty. And then the other question, has anyone even asked students for their input on how the semester should be finished out? Because it seems like the school just did whatever it wants to do and doesn't care about what the students are going through.
Yeah. First, thank you for both of those questions. And let me just say, I feel the frustration in the questions. I'll start with actually the second question, President, if that's okay, and that is, where was the student input in all of these decisions that are being made, things that seem just sort of thrust upon students, perhaps? Please know that as part of the normal operations of the university, we have a student body president in our president's council. We have student representation on most of our councils and committees. And from the start of this, our efforts to really respond and and reach out to students on COVID-19, we've had some of our student senators, we've had some student council in the room helping us make these decisions. In addition to that, at every turn, we are staying attuned to the world around us on social media, staying attuned to other things that other universities are doing, and we're staying attuned to the national and local forces. In that, we're also staying attuned to student voice. And so anytime we hear from students, even if it's just an email, we bring that into the conversation, we consider it, and we want to make sure that we're making the best decision possible for all of our students. Now, to the first question of it just somebody expressing that it seems like decisions are made without thought to the students, I don't know how else to just communicate that we, again, at every turn, are thinking about the student experience. We are not wanting to have anything negative happen to our students. We are not wishing anything negative to happen to our students, but we are simply responding in the best way we know how to address the needs, the educational needs of our students and the mental health needs of our students. And so with that, I would just tell the student who wrote the question and any other students who might feel like they're not getting information fast enough or the rationale about all of our decisions, please know we meet as a cabinet every single day. The COVID task force meets every single day. We are constantly getting information and trying our best as possible to make the right decisions for your health and well-being.
Yeah, so I just want to underline the message that your welfare is absolutely foremost in our minds. Some of these decisions, we have to make sure we are aligned with what the governor is saying, what the Centers for Disease Control is saying. And so we are balancing many different facts, new information, new developments. But at the heart of it all, whether it's the cabinet or the faculty senate, the staff when they meet, and when these decisions are made, foremost on our minds is your welfare, because we want you to succeed. You're the very reason why this university is here. I want to thank Vice President Kyle Reyes for answering a lot of questions. And very quickly, I'd like to bring in Vice President Val Peterson, who is over finance and administration and also oversees our facilities. These are just two quick questions that would be useful for students to have answered. So Val, welcome to our town hall. The first question is, how will the summer semester students receive their textbooks from the bookstore if the store is closed due to COVID-19?
Thank you, President. So as many of you might know, we've already sent out an email talking about the fact that we are switching how we're doing our book processes anyway. And so this summer there wasn't going to be any books in the bookstore because we're shifting to BNC services. And when you go out and you register for your classes, you can go to Canvas and you can pull out what materials will be available for those classes and order those online, and they will be shipped directly to your home, or you can have them dropped to the bookstore. So it'll be the similar process to what you did last semester, but we will be shipping those directly to your house or to the bookstore where you can pick them up.
But is the bookstore closed today?
The bookstore is open. We're conducting business there. You can go by there if you'd like and be able to get materials that you might need for your classes. And they'll be able to help you if you have an issue with your book order.
Yeah, so just to reiterate that the bookstore is open, the library is open, the computer lab in the library is open, and these are some of the facilities that we've kept open for you. We have closed practically everything else, but we have identified the critical services that are needed, and the bookstore is one of those. But what I love about this answer is, in essence, it's like ordering your books from Amazon.com.
Absolutely, President. What's really exciting is that we're doing this transition so you can have them just delivered to your home. You're not going to have to wait in line. You don't have to go pick them up off the shelf. They'll just be delivered, and you'll be able to use those for the next semester.
And we can free up space in the bookstore for more other exciting merchandise. And you also have the option to pick up your books at the bookstore. So I think this is reasonable and convenient, and I hope that you take advantage of this. The second question, Val, is, can I get a parking pass refund since I am no longer going to the main campus because of COVID-19? So parking passes.
So, as all of you know, we've gone to online education, but our transportation network is still functioning just like we're still offering classes, so we're not offering any refunds at this time. UTA is still functioning, UVX is still functioning, and so our transportation network is still functioning, and so we're not offering refunds.
So, in other words, there are still expenses associated with keeping the transportation network functioning.
Absolutely. Okay. So part of the parking pass money goes to help provide for those free bus passes that we're utilizing for UTA. So if you're riding tracks, front runner, or if you're riding UVX, that is subsidized by part of our fee that comes from parking services. And so that's still running. We still have students who are utilizing those services, and so we're not providing a refund right now.
Thank you, Val. Please join me in thanking Vice President Val Peterson. There are two questions that I would like to answer. The first one is, why are we always the last university to put a statement out on graduation, on class grades, on the COVID response, etc.? I am not sure that we are the last university to put out a statement. I don't think so. But what I want to tell you is there is a process. Every Monday, I have a meeting in the Council of Presidents, which involves all of the presidents of the 8 Utah institutions of higher learning. So University of Utah, Utah State, Dixie, Weber State, Snow, Salt Lake Community College, Southern Utah University, UVU. And every Monday, the presidents, together with the Commissioner of Education, actually share what we are doing, what our challenges are, what's going well, and so on. So there is a process. Secondly, from that level, we have here at the university, as Robin Ebb Meyer mentioned earlier, she has been tracking COVID-19 since January and briefing the cabinet. And so every time we make decisions or put out a statement, these communications have gone through a lot of discussion, a lot of vetting. We're not simply going to copy what another institution is doing or make an announcement hurriedly because we want to be the first to make the announcement. We want to be thoughtful. We want to be thorough. We want to do what is best. So please know that the communications and announcements that you are getting, none of this is being done haphazardly. It is being done with exceptional care and exceptional accountability. The next question is, do you feel like this virus will cause new UVU virus protocols to be put in place? I think what will happen when the dust settles is that it's not just UVU, it's not just Utah, it's not just the United States, but it's all types of organizations, all countries, all different bodies, governance bodies will be looking to this period of the COVID-19 pandemic and asking, what have we learned? So it's not merely an issue of having a virus protocol in place, but what are the things that we can do early on? I don't know, dear Wolverines, if you remember the tragedy of 2004, when a giant tsunami hit the Indian Ocean, this was the day after Christmas, killing 275,000 people. And then in 2011, we had the tsunami in Japan that killed 16,000 people. What happened after that was the evolution of a tsunami service warning. You cannot prevent tsunamis, but there can be a warning system where people collaborate and do their research and cooperate to put something in place so that the responses the next time around will be such that more lives will be saved. So I think when the pandemic is over, none of us will be the same. We will all have been affected. And then what that means for our processes, for how we do learning, for how we do pedagogy, for so many things, we will want to be smarter. We will want to be better. We will want to be more caring, more competent, and more confident so that the next time we face anything similar to this, even though we can't prevent it, hopefully we will have indeed these so-called protocols or structures and processes in place that make us better prepared. So in closing, I would like to first put up a slide that I think is so important for all of you to know. You can take a picture of this, and if you can't take a picture of this, go to uvu.info. So these are the FAQs frequently asked questions. If you look at what's listed here, whether you're an employee or a student, or your question is about events or travel or safety, there will be an FAQ. That's the right FAQ that you can consult. So this is all at uvu.info. And what we are doing is we are updating this as we get new information and as policies and measures in place change. I also want to leave you with a thought, and if we could look at this quote for a second. Many years ago, I got into studying Buddhism when I was living in Hong Kong, and I came across this book that I really love. It's by a Buddhist nun whose name is Pema Chodron, and the title of the book is When Things Fall Apart. I'll just read this out loud to you, and you can see it as well. The essence of life is that it is challenging. To be fully alive, fully human, and completely awake is to be continually thrown out of the nest. The phrase thrown out of the nest resonates with me because when my children were little, I loved reading a book to them called Are You My Mother? And it centers around a little bird that falls out of a nest. And so this bird goes around asking, a big machine or a pig or a cow if they're their mother. They've been thrown out of the nest. And it's a very uncomfortable feeling. And yet when you finish this quote, it says, to live fully is to be always in no man's land, to experience each moment as completely new and fresh. And so I'm sharing this with you to encourage you and me and all of us to remember that these moments when we are in uncertainty, when we are in in-between places, when we are in places where we don't know 100% what's next, these are also really good moments to embrace. These are also really good moments to ask, what can I do more? How can I help others? How can I build this community? How can I strengthen my commitment to my own education? How can I be a true Wolverine, in other words? And so I'll end with this last slide to say again, thank you to each of you. Grit is not just a word. We do not throw this word out there and then do nothing. We throw this word out there because it is important and it is something that we live every single day. You are helping your roommates, you are helping your family members. Even though we're socially distant, we have ways of connecting with each other to strengthen that human tie. And I know that as Wolverines, we will continue to help one another, strengthen this community. And I want to end with a very big thank you, not only to all of you on this broadcast today, but all of the people behind the scenes, my cabinet, the staff at UVU, the faculty. And I want to finally quote the chair of our Faculty Senate, Professor Ann Arndt, who teaches technology management. She shared in one forum that one of the things that she will really remember from this time is the feeling of community at UVU. Yes, we are strong as individuals, but we are stronger as a community. Dear students, please know we think of you every day. We love you and we believe in you. So please work with us, be patient, do what you can, communicate with us. Thank you again. Carry on. Go Wolverines. Thank you.